Imagine a high-stakes brain surgery where the surgeon isn't even in the room. In a clinical breakthrough at Peking Union Medical College Hospital, researchers have validated a new robotic system called the YDHB NS01. This Chinese-made robot just proved it can navigate the complex vascular highways of the human brain faster than a human can. It didn't just match the performance of a neurosurgeon, it slashed the procedure time by nearly 30%. We are officially entering the era where the steadiest hands in the operating room are made of steel. Traditionally, cerebral angiography is a grueling manual marathon for neurosurgeons. The procedure involves threading a thin wire from a patient's thick all the way up into the brain's delicate vascular network. Doctors have to stand for hours draped in heavy, stifling, radiation-shielding gear to protect themselves from X-ray exposure. Even the most elite surgeons face the constant threat of hand tremors or physical fatigue during these high-stakes maneuvers. The YDHB NS01 changes the game by moving the surgeon from the bedside to a shielded remote console. From there, they use a high-precision interface with force feedback to feel the resistance of the vessels without the physical strain. It effectively removes human vulnerability from the equation, allowing for a level of stability that manual surgery simply can't guarantee. The clinical results from Peking Union Medical College Hospital were nothing short of a perfect score. In a head-to-head trial involving 50 patients, the robotic system achieved a 100% technical success rate. Every single target vessel in the brain was visualized with perfect diagnostic clarity, just as if a human had guided the wire. But here's the kicker. While the success rate was identical, the efficiency was not. The robot slashed the average procedure time from 38 minutes down to just 27 minutes. That is a 29% increase in speed, saving 9 critical minutes per surgery. Even more impressive is that these results were achieved by a junior neurosurgeon with less than 3 years of experience. After only 2 training sessions, this young surgeon was able to outperform traditional manual benchmarks using the robotic arm. One of the most significant wins for this robotic system is how it protects the medical staff. In traditional manual surgery, neurosurgeons are essentially radiation athletes, wearing heavy lead aprons for hours on end. Over a career, this cumulative X-ray exposure leads to high risks of cataracts, malignancies, and debilitating spinal disorders. The YDHB NS01 allows the surgeon to step out of the radiation zone entirely and operate from a shielded control room. Interestingly, the study tracked a learning curve that was remarkably short for such a complex tool. While the very first 2 procedures took longer as the surgeon adjusted to the interface, the next 23 were consistently faster. The robot's specialized one-way valves and dedicated guide wire holders eliminated the need for repetitive manual switching of equipment. This means that instead of focusing on the physical strain of the gear, the doctor can focus entirely on the patient's brain. While the YDHB NS01 is a triumph for Chinese engineering, researchers are quick to point out that this is still only the beginning. The study at Peking Union was a single-center trial, meaning more testing is needed across different hospitals and patient types. One of the biggest hurdles remaining is haptic feedback, the physical sense of touch that a surgeon feels through their own fingers. While the robot is incredibly precise, it still lacks the full tactical intuition that a veteran human surgeon develops over decades. There is also the challenge of distal vessels, the tiny hair-like pathways deep in the brain that are still difficult for current robotic arms to reach. However, the integration of artificial intelligence could soon bridge these gaps, offering even higher levels of automation and safety. As Dr. Zhao Yuanli noted, we are looking at a future where robotics encompasses the entire diagnosis to prognosis continuum. The YDHB NS01 has proven that the vascular highway is no longer a human-only domain. It is a collaborative frontier for man and machine. Thank you for watching and please subscribe to the channel. See you in the next video. Bye!